We're like, great. Good evening, good morning, depending upon, and even good afternoon, depending on which part of the world you are in. My name is Viswanath. I'm a professor at the Harvard T.H. School of Public Health. I'm a professor of health communications there, as well as the faculty director for Harvard Chan's India Research Center in India, obviously. So I welcome you all. I want to, I know this is a Friday evening. This is a little complicated. We have a hybrid event. We have two speakers here in the room with us, as well as two speakers who are on the Zoom. And then we have audience or audiences, I guess, so a group here in the room and a group on the web. So the way we want to work or organize this is that I will do a brief introduction, followed by asking the panelists to give us maybe a one or two brief overview opening remarks. You can say whatever you want to say, as long as it's with the topic. You can even talk about the movies if you want, but and then I will start asking questions. At some point, we will ask audience participation. We will take your questions. Feel free to post your questions in the question and answer box. Ramya, I'm thinking that's the way to do it. Let me know if I'm wrong. And of course, we have audience who are also live. So we will ask you to just raise your hand and ask questions here. Okay, great. Thank you. So let's go ahead and start. When we often talk about development of a country, nutrition indicators or indicators of nutrition or healthy nutrition are key to that. We also often gross domestic product or gross national product and other kinds of economic indicators are invoked. But a true development of a nation manifests itself in the nutrition indicators. And with the Indian government of India, I think, taking up the Prime Minister's overarching scheme for holistic nutrition, Poshan Abhiyan, as it is known, in March 2018, there were a number of large-scale efforts to improve nutrition outcomes among children in India. It is an interesting inflection point where I think the focus was on mass mobilization, the so-called Jan Andolan, which is what is needed, I think, for something like this, something as complex and as huge a task as this is. So the mission is unique, has attracted a lot of attention, not only in the country, but globally. And there have been a number of reports tracking the both the successes and failures of different types of programs. So what we want to do, I think, is we convened a group of experts who are spending their time, day and night, and careers focusing on these issues. And we thought we will have a conversation with all of you on this very important topic. I also know that there are people in the audience who have been working in this space, and we would love to have your participation. So before I begin, I should thank, this event is sponsored by the Harvard T.H. School of Public Health India Research Center, the Lakshmi Mittal and Family South Asia Institute, our counterparts on the other side of the river in Massachusetts. They are in Cambridge. We are in Boston, separated by a river, so though I live in Cambridge, so it's, so
You're on both sides.
I am on both sides, whenever it is convenient, depending on the convenience. So plus Project Sanchar. Project Sanchar is a BMGF funded project around building capacity among reporters and journalists on reporting on science and health, as well as working with building capacity among decision makers in using evidence base in strategic communications. So let me briefly introduce the panelists. I'm so thrilled that we actually managed to get the four of you. The stars have aligned, and so to speak. First, I'll start introducing my colleague and friend, Dr. Subramanian. Nothing to do with priorities or privileges here, right? I just, in the order, I do what I'm told by my team here. So Dr. Subramanian is a professor of population health and geography in the Department of Social and Behavioral Sciences at Harvard School of Public Health. Professor Subramanian has published extensively. I think there are very few people in this space who do not know his name or his work. He has published over 600 papers on a variety of issues, particularly around social determinants of health, around nutrition, on different geographic areas, both in the US and more recently, he has been focusing on India. He's one of the most highly cited researchers in the world in this space. But what I think, I can take the entire time introducing Subbu. I won't do that because we have such distinguished panelists. But what might be of interest to this group is Dr. Subramanian has started something called Geographic Insights Lab, which actually provides information by looking at place, as we say in social determinants of health. So he has that lab is quite innovative, and I think hopefully we will have an opportunity to share the URL for the lab with the guests here at some point after the talk is over, after the session is over. But it's quite impressive in the way it provides insights into nutrition development in a variety of states in India. But more than the states, actually, it goes down to parliamentary constituencies and districts, and subject to a variety of interpretations. So in addition to that, he has a number of other roles including editing journals, etc. So we are delighted. Thank you, Dr. Subramanian, for joining us. I'm also delighted to introduce Dr. Hemalatha. Again, if you are in this space, you would know her. She's, technically as a title director of ICMR's National Institutes of Nutrition in Hyderabad. I have to add, from my hometown, so sorry, I have to interject that editorial note. So that's a special welcome for you, as a fellow Hyderabadi, I guess, so. But seriously, what is interesting, in addition, she's a scientist, scientific leader, and now a science administrator, which means not only she's continuing to pursue her scientific work, but she's managing to lead an institution driving science and policy, on such an important topic in India. What is interesting, I wanted to add a couple of things about her, which would be helpful to contextualize her reputation as a scholar and a scientific administrator. She has done made seminal contributions in basic sciences around nutrition, but then she has also done, focused on practice. One interesting thing I have seen here is she has developed a preconception education kit, that informs newly married couples and their family members on how to ensure good nutrition and health of the women in preparation of pregnancy. So it is both science and practice in operation, the translational sciences, as we call it. And she has won a number of awards, too numerous to list here, but it shows the recognition she has received for her work. Third, we also have Ms. Mini Varghese from, she's a country director for Nutrition International in India. I had a wonderful conversation before the program started with her and the work they are doing. She has more than 2 decades of experience in Indian public health sector, led programs related to maternal, adolescent, and childhood nutrition programs. As a country director, she provides strategic direction and leadership to nutrition programs, including Anemia Mukt program, a topic I guess is on everybody's mind these days. And her work is, I think they work across 5 states with concentration, but you work in 11 states actually. So thank you for joining us. And last, but certainly not the least, as a cliche goes, is my colleague and friend, partner in crime, and some of the things I have mentioned earlier, Dr. Pooja Sehgal. Pooja has a lot of experience. It's interesting. I think, you know, she comes from, she takes the lens of an engineer and a marketing expert in addressing issues around nutrition. So she's a country lead at the Bill and Melinda Gates Foundation for Health and Nutrition Communications, obviously a topic close to my heart. And obvious, you know, I'm sure most of you know her and her work with over 2 decades of work in marketing, branding, and communications in a variety of sectors. And now she's leading the nutrition portfolio. And you have what we call as, you know, perch, catbird seat in the American expression, where you are able to watch, you know, how different players and institutions are working in this sector. And hopefully you'll bring that. You're modestly saying you are learning from them, but I know from personal experience, you also contribute a lot. So welcome everyone. Thank you so much. I have taken a bit of a time to introduce them because I'm so thrilled that you were able to join us. Also want to thank the audience and of course, our teams at the South Asia Institute and the Harvard Chan India Research Center for working so hard to put this together. So I want to start with some, give an opportunity to the panelists to say what they think are the 1 or 2 important issues that are occupying their mind these days around issues of nutrition. I'm sure you need more than 2 minutes, but let's start with a couple of minutes as opening remarks, just to see what are you thinking these days as critical nutrition area related issues. So Dr. Hemalatha, can we start with you? You may be on mute.
Thank you, Dr. Viswanath. And I'm equally delighted to have my co-panelists, especially Dr. S.G. Subramanian. I read your papers with a lot of interest. Thank you so much for being, and also Dr. Pooja and Dr. Mini Varghese. Here, I would like to tell a few words about 1000 days. And I'll assume that you do not know anything, and I'll tell about that. That is 1000 days, right from conception to birth, and the first 2 years of child, that is 270 days plus 365 and 365, that makes 1000 days of nutrition has been identified as critical period, which can shape the child's future. So here, when the child, during fetal life or early childhood, when a child experiences poor nutrition, that continues during adult life. And also if it happens to be a girl child, the mother will be stunted. She will become a stunted mother and give birth to a small child who is also stunted. So it can, the undernutrition during fetal life and early childhood can pass on, continue during adult life, and also span across generations. Um, it can impair immune functions and also metabolic functions, and can cause increase the frequency of infections, communicable as well as non-communicable diseases. So we in India have a very ambitious program, that is Poshan Abhiyan and the National Nutrition Mission, which was launched in 2018, 18th of March. Under this, the focus is on 1,000 days, and the program aims to prevent intergenerational malnutrition through life cycle approach. And it has been designed very well, like convergence of several ministries, right from grassroots level to the uppermost ministry level bureaucrats. And also it harnesses technology, then capacity building, behavior change communication. So many components are there. Altogether, about 7 pillars are there on which it rests. And nutrition supplementation also in various forms, like dry rations are given, then hot cooked meals, and subsidized staples are given, again fortification and nutrition supplementation. In spite of all these robust programs, we still have quite a significant level of low birth weight prevalence and also small for gestational age. And we have seen time and again, not just now, but a few years back, even the latest data shows that children who are born small continue to follow the same trajectory. They never reach the level of kids who are born with a normal birth weight. So the trajectory continues. And we are not sure if this stunting level or small baby has any functional consequences. I mean, few studies are there to show about non-communicable diseases and communicable diseases. But with respect to cognition, we are not very sure. And any functional impairment that can happen because of consequence on the size of the baby, we are not sure. So like this, in India, on several standards, we are not very clear, even with anemia as well. So these are some of my initial remarks.
Great. Thank you so much. So I'm going to go to Subbu next. Subbu, what's occupying your mind these days?
Thank you so much, Vish, and thank you to my colleagues, Hemalatha and Pooja and Mini. It's a pleasure and an honor to be sharing this with you, and I'm looking forward to learning from this. And thank you again, Vish, for putting this together in this. It's very timely, given that I think Hemalatha would know, all of you would know more than I, with the Poshan 2.0. What exact form and shape it's going to take. And so this is very timely, and I would encourage both your center, Vish, as well as your network, to perhaps do some more so that we can in a timely way inform the design of Poshan 2.0. Having said that, I've had the privilege of engaging on this topic over the last 5 to 10 years or so. And of course, my thinking has evolved. So I will share about 4 or 5 points, and Wish we can come to this later in the discussion. And I would love to hear thoughts from my colleagues as well, who are much more deeply involved with this. First is, I feel like, having spent some time working on this issue of childhood and nutrition, there seems to be kind of an accepted notion that we are sure about what we are going to measure, the metrics related to nutrition. And somehow I feel like anthropometry has taken a kind of an uncritical position or place. It has its place, for sure, it does. But I'm not sure it is the end all. In fact, it's rather recent that an anthropometric focus has been so, and of course, as we all know, and I'm sure many would agree, anthropometry is complicated, especially when it has intergenerational components, some of which that Hemalatha just touched upon, whether it's weight and certainly if it's height. So one thing is like, I'm sort of moving more towards what should be the metrics of measuring a child's or an adult's nutritional status. I mean, we are also kind of quite, at the adult level, should it be BMI or something else? So I think there is at least that is something that I am, having spent some time working in this area, I feel that we need that. Otherwise, we just keep going in circles. The second point that I want to sort of raise again, which links to briefly what Vish talked about, which is my current project out of the lab, which is called India Policy Insights. So a couple of things there that I want to make a point. Number one, I feel like, once we have figured out the interventions, etc., a big thing in policy is whom do you target? And clearly there is variation. There is kind of some sections of the population are more disproportionately disadvantaged along nutritional indicators, regardless of how we measure them, or a variety of ways in which we can measure them. So bringing some degree of precision in terms of what populations to target and monitor, because and any India level statistics, as we all would know, would be practically useless, and that's where the learning might be. Like, why do we find that in some districts of Kerala, let's say stunting or underweight is still 20%? What more can they possibly do at this point, right? And why, say, in a district in Bihar, it is actually doing quite well given the circumstances. So what might be happening there? So that bringing that precision or granularity in terms of which populations, and one way to define the populations would be geographical. So in our work, we've been focusing more on small areas, including drilling it down to the villages. Later, if I have a chance, I will just do some shameless advertising of what we have on our site. Point number 3 is I feel that with the launch of Poshan Abhiyan, in fact, under this administration, it is the first time I would say that people are familiar with programs. There are so many programs, and there is something to be said about it. There is a mainstreaming of these kind of what were largely like kind of happening in like policy circles or academics and so on. There's a kind of a general awareness or education around this. And I feel there is a momentum here that could be tapped. Until about recently, everybody would say on matters related to health or nutrition or well-being, social type stuff that we all focus on. Ultimately where it hits a complete roadblock is, there is no political will. So how do we bring that political will? And one way in which I feel is, can we bring political synergies into public policy space, which is by and large dominated by either technocrats or experts like us, or bureaucrats, very enlightened bureaucrats in India. But I feel all these three groups have very little skin in the game. So we may bring some expertise, but unless public policy is married with political synergies, it's hard. So with that in mind is why we've been focusing on coming up with these indicators at parliamentary constituency level, and especially at the assembly constituency level, because matters related to health, nutrition, and other well-beings are really happens at the state level. So that's my third point. My fourth point is like, I think Hemalatha gave an excellent, in the very short time, what the 1,000 days is all about. And I feel like, building on that a little bit, I would say like, the first thing in 1,000 days, based on some recent work that we have done, the survival still remains a big issue. Especially the survival in the first 12 months. And of course, if you further break it down, if you break it down in this less than 2 years, like post-conception pregnancy and the first 2 years of child life and after, because we have this somehow the 0 to 5 frame in our head, the first 2 years is a big survival agenda, I feel, and especially the neonatal and the post-neonatal mortality. When you look at it, India has done remarkably well on child mortality, see, which is above age 2, but not so much on the below. Again, remarkable progress, but there is a fair bit, some degree of focus in the first 1,000 days would be very helpful. When it comes to nutrition within the 1,000 days, I would make the case for three things. One, I think it's time to focus on social determinants of health. Why? Because there is very little institutional programs for children under the age of 2. They are in the houses. ICDS was very visionary when it started. I'll talk about it later. In 75, it was, even in a high income country, nobody thought about that kind of an approach where a child needs to be stimulated and we should think about child development. Now people are talking about ECD, but ICDS was kind of visualized or conceptualized along the side of Head Start in the US. How do we give children from the lower socioeconomic backgrounds the same kind of start as children perhaps from our backgrounds, So in nutrition, I think the focus on social determinants of health, I think it's time. And within that, I would say food, a direct focus on food is essential. And this is where it may become an operational problem. Some things you can drive through Anganwadi, but ultimately the first 2 years are in the house. So household, I feel, needs to be a big focus and not just parcel out always as a mother-child thing. Typically when a mother is deprived, there are exceptions, but the typical scenario would be if a child is deprived, a mother is deprived, the household is deprived. So that's my within 1,000 days what focus. And last but not the least, I would say that the 1,000 days should be seen as an organizing framework, and more than an organizing framework, as a starting point, both for biological reasons as well as social reasons. We adapt. And I want to sort of point this out to a study that no one points out, well, not much is talked about it. From Sweden, when about 200 orphans from India were actually adopted by Swedish parents, and some were as old as 5 years. And the dramatic improvements that they saw, including in parameters like height, it tells you something. So what was different there? I feel it was mainly this aspect of security, economic security, food security, health security. You're not worried about it. But the point is that I want to make in this 1,000 days is we should not, especially when it comes to indicators of anthropometry, not ignore the over 2. So again, so I'll stop there, and partly because, our bodies are, and physiologically we are very malleable. So we adapt. There's lot of plasticity, and there's a lot of evidence for that. So I hate to kind of slot this as you are doomed if you somehow miss. No, I think we can still do a lot after that. So we should not lose that focus. So I'll stop at that. Sorry, Vish, for taking a bit too long.
That's okay, Subbu. I'll hold you against that later. So no, actually that was very helpful. Thank you for those very clear insights. Particularly, I will come back to this issue which you have raised more than once, that we need to focus beyond the first 1,000 days, in addition to the first 1,000 days. Some of your earlier work has shown that also on the intergenerational conflict. Not everybody knows that you published some papers almost a decade ago on this issue, I think using a variety of data sets. So we might want to come back to that to elaborate on that.
Sure.
So thank you. That was great. I'm going to go to Pooja last because of the position you hold. I think I want to come back and ask you on those. So, Ms. Varghese, what do you think?
So, nutrition, whenever we talk, there is a lot of challenges around. So whenever we look at nutrition per se, that, we know that India is not able to make the dent in nutrition in spite of all the efforts that we are doing. It's not that impact or the desired outcome is not what we are getting at. So that is makes, and the sheer volume of population that we have and the magnitude of problem amplifies a lot. We do know that thing, for every dollar we put it, the returns is about $16. Then why, as a growing young India, that we should not make this investment to make things to happen? So that calls us to be extremely urgent about, if you wanted to progress, because in most of the time we assess progress of a country on economic terms. So investment in nutrition is something which is not just an investment to make people good, but it is also helping economies to grow and to be a developed country. It's very, very critical. So that's number one kind of a thing. Second thing that I would talk about it is nutrition change is not something that not very, we often say that what is the low hanging fruit. So in nutrition, we also say that what is the low hanging fruit that we can immediately make change on it. But we do know that the changes are not so drastic as what we think. So what is the low hanging fruit within the nutrition that we can invest more? It can make change on it. So that makes me to say that you just concluded telling that the intergenerational impact of nutrition, and we do know that thing, and also working on 1,000-day space. Now more and more recognition in practitioners are there. Probably we are not addressing, pregnancy is too late to address women. If we are just making sure that with all the better health systems and everything that, so we need to invest much before than they become pregnant. If you wanted to have changes to be observed in the country and observed in our population. So probably it is not just 1,000 days. So there is understanding that we need to invest much more. We need to invest in our adolescents. We need to invest on pre-conception nutrition, probably at the time of marriage, at least, So at the same time, we have limitations of our platforms. If you wanted to reach general population, how do we address this population? With what platform to deliver it? So some of our national program, including the Poshan Abhiyan, has effort towards reaching 15 to 49-year-old women. We are not able to reach because you need to have an event in your life to be accessing services. An event, I mean to say that, either you need to be pregnant or you need to have a child. So these are the events or points where services are there. So we have to create platforms, we have to create to see that, so that in mostly in West, we do hear that, pregnancies are planned, people plan about it. And it is probably in India, it is not, that's still not happening. Even if it happens, it's for a smaller, very, very minuscule population, it is happening. So it is important that, we invest our energies and efforts to strengthening our programs and our approaches, strategies towards adolescent preconception nutrition, if you wanted to make a dent in the 1,000-day program. The other, we also have more and more evidences coming through is that why we need to invest in nutrition is primarily because if you invest in 1,000 days, we do good programs with optimum coverages, essential micronutrients. It does not just have impact around the outcome, the pregnancy outcome, but it also has long-lasting impact on reduction of NCDs. So this has become more and more clear now that, and we also know that we have a growing problem about non-communicable disease in this country. So if 1/3 of the 2/3 of children, if you are born, is underweight, and while there is window of opportunity to recover it, we are also having a missed opportunity, or we are having a country like India, we need to set up more costly investments to treat and manage non-communicable disease. So In point of economic growth, in terms of investment that it will cost for economies to make it, I think so. Nutrition is not an option that countries can make it. It is an essential, like investment that countries need to make it. So these are some of the my reflections on it, like as we talk on nutrition for us to take it forward in this country. Yeah, thank you.
Excellent. Thank you. So some themes are coming up in the among the first three panelists. I'll come back to them in a second here. But Pooja, you sit in this wonderful position of knowing what different groups are doing, different people are doing. What's occupying your mind as you think about it these days?
So thanks everyone for giving me this opportunity. And I think I'm going to be, like I said earlier, learning from everybody who's speaking today rather than contributing that much more. So I'll be very honest when I come to the understanding in terms of the 1,000 days and the interventions. I'll actually want to sort of present this differently in terms of what you just asked me. What is it that's going on in my mind around the whole theme of nutrition? When we look at the current ecosystem around us, and we're actually currently sitting in the middle of the festive season, and you're sort of progressing towards the time of the year, at least in North India. This is a time when there is a whole lot of celebration, and our celebrations include food, a whole lot of them. When we look at food, we're looking at feeding our families, feeding our loved ones, feeding our children. And really, the aspect about feeding for us, for the common person, for largely the bulk of us, is about making sure that they've had a plate full of food. Okay? How much of that plate full of food is actually translating into plate full of nutrition, and the right kind of nutrition might not necessarily be top of our mind. And that really, to my mind, is the big gap area, because we're thinking food, we're thinking calories, we're thinking, oh, I've done my job and tick that box because somebody has been fed. We're not necessarily always breaking that down from a calorie to a nutrient sort of understanding. And that lack of understanding across the spectrum is one of the bigger challenges I feel that we face across the entire, whether you talk about 1,000 days, you talk about adolescence, you speak about preconception, eating habits, as well as after the baby is born. And creating that understanding, creating that clear distinction between food is not necessarily equal to nutrition, I think is one of our biggest challenges when we look at any intervention, which is essentially around enabling better nutritional outcomes. If we were to sort of start to break the entire, continuum of care sort of down, and to your point, Vinny, essentially about, whether it's increased immunity, whether it's, the right kind of growth, and we spoke about stunting and intergenerational challenges, or whether it's about your own ability to sort of deal with health challenges and onslaughts. And a lot of us have been through that in the last couple of years through the pandemic. The core nutritional strength that you might have built becomes really, really critical. And therefore, a good understanding of nutrition as a core element of our overall education and our overall growth becomes really, really critical. And I think as a nation, we probably are not doing as well on those aspects. The interventions, when you talk about Poshan Abhiyan for that matter, I think are fabulous because they start to make us think about nutrition as against only thinking about food. And I think just making that distinction and building that understanding about what is core nutrition and why is it important, not just in the moment, because, as a mother would say, my child is well fed and peet bhar ke kha liya, but more in terms of the overall long-term impact, whether it's cognitive ability, whether it's productivity as you grow up, whether it's your ability to fight disease and stronger immunity. And clearly marking all of those linkages and teaching everybody, including my mother, even today, who says, "Oh, have you had your food?" Never asking the question about what did you really eat and how healthy was that. So that, to my mind, is an important intervention that we need to think about. And if you ask me, that's really what's going on in my head these days, because I'm seeing food all around me and all those lovely sweets that everybody seems to be wanting to exchange, and also feed their children, not necessarily thinking about how healthy it is and how nutritional impact it will have. Thanks.
Great. Thank you, Pooja. Having done a number of these focus groups recently, examining and exploring this in greater depth, certainly there is a great misunderstanding of nutrition versus quantity versus, what you eat. So I think we can come back to that. So there are a couple of themes that were running through. So I want to ask the panelists those maybe broad themes, questions around those broad themes. So one is each of you, as you spoke, so the topic of this panel was first 1,000 days of a child. All of you were very disciplined. You started there, and then you lost the discipline. I'm just teasing you, and each of you expanded the age groups where we should focus on, right? It's not just enough first 1,000 days. Some of you said, well, we should focus even earlier, not just stop there. And Dr. Hemalatha and Subbu have also talked about expanding it beyond the first 1,000 days, even though the first 1,000 days are critical. So I'm just curious now. We haven't even talked about anemia and teenage girls, where the data are pretty telling, So my question is, so even as we talk about Poshan Abhiyan and Poshan Abhiyan 2.0, where should we start? If we start everywhere, then we are starting nowhere, right? I'm just putting on a advocacy or a policymaker's hat. We have to prioritize some things. So where do we start? What are the different age groups, or which demographics should we start in focusing on this? Because, based on what you're saying. So maybe Dr. Hemalatha, can we start with you? You are on mute. So.
Extremely sorry for that. Yeah, they're still not done with 1,000 days. Even today, we see women in India on an average gain hardly around 8 or 8.5 kgs during the entire pregnancy. And you can come across women who just gain 4 to 5 kgs. They're just definitely not done the pregnancy part yet. And coming to the next part, that is the early childhood feeding. IYC of practices, hardly, early breastfeeding, early initiation of breastfeeding, and exclusive breastfeeding, even though the data in NFHS 5 shows that it is 50 to 60% of our children are exclusively breastfed, it is hardly 30% or even less than that, if you take exactly the 6 months period, because they give the data for all the age groups, right from 1 month to 6 months, which does not reflect the true picture. And coming to the early initiation part, although programs are there, most of the hospitals do not have the infant breastfeeding policy in place, which is supposed to be there and which needs to be communicated to people who get admitted and also to the staff. And most often staff, most of the people are not trained well enough to counsel the parents or the pregnant woman or the people who accompany them. So early initiation is a failure. Very few people, it's not strong enough. And breastfeeding, exclusive breastfeeding practices also needs to improve a lot, and also complementary feeding. Hardly 85 or 90% of the children get adequate quality food. Even though some may meet the calorie requirement, quality is extremely bad. Hardly they get just the staple cereal-based diet. When the calorie requirement during that period, that is 6 months to 1 year, is just 300 to 400 kilocalories apart from the breast milk, but their micronutrient requirement is 10 times more than that is required by an adult. So when their micronutrient requirement is so high, if the diet is just based on staple, that is cereal or wheat based, they cannot meet the micronutrient requirements on that kind of diet, and fortification is the only way. Otherwise, we have to strictly follow the dietary diversity, that is inclusion of fresh foods, inclusion of fruits and vegetables, inclusion of sufficient nuts and oil seeds. These are all lacking. So we need to intensify our focus on 1,000 days. But I also agree preconception is a very important critical period, because 20% of our women who enter pregnancy are thin. Another 20% are overweight, obese, which is also a consequence of pregnancy, and 50 to 53% are anemic. So more than 50% of our women who enter pregnancy are malnourished. So the consequences are huge. Yes, we need to focus on preconception, especially again during preconception. Somehow this adolescent phase is not a very good phase to focus attention. Even that is also good, but then what I would feel is we have to engage couples who are married and who are planning for pregnancy. So we have developed a kit for that, which promotes, like, we have to reach people who are couples who are married or who are planning for pregnancy, and we have to counsel them about the right age for pregnancy, nutrition status, anemia checkups, thyroid function, and hypertension, small issues around health as well as nutrition, so that the mother who enters pregnancy has sufficient knowledge about nutrition and has appropriate age to conceive, and other factors also can be addressed. So what I feel is, like, apart from, we cannot leave 1,000 days as yet. We are performing quite badly, although there are robust programs. That's because, the panelist has pointed out about nutrition education. Yes, education is required, but then even among the scientific community, we are not very clear about what is good and what is bad. Even now, our dietary recommendations, promote so much sugar and fatty, extracted fats and oils and vegetable oils and fats, which are actually not contributing to any nutrient requirement. This is just one example. And so here in N9, we have my plate for the day, which does not have a place for sugar. Sugar you can take as an option, but it is not mandatory for your nutrient requirements. Again, I'll stop with that. Thank you.
Great, thank you. So one theme that keeps coming up is a quality versus quantity, and what are we focusing on? Ms. Varghese, you were arguing for a much wider band of focus than, I think we heard about starting with pre-pregnancy, not just the first 1,000 days, even though the attention should not be diverted from there. And you wanted to expand that band. Tell us about that.
Yeah.
Why?
So I think I probably has tried to say that why we should focus on pre-pregnancy, primarily like that, by the time a pregnant woman come and, recognize a pregnancy and come to to a health facility, we already lost about 3 months, even with all the thing, the NFHS shows that, it's about 70% of women are it's just a considerable progress from the previous one, is reporting their, so it's a lost opportunity for us of 3 months where, some essential nutrition, health services we could have provided, we lost during that time, because our ANC registration, the ANC services starts out of the 9 months, 6 months, and out of it, further it get reduced. So it is therefore, that's one of the reason that, which would say that, and secondly, that thing, more and more we have evidences very strong, which says that, probably we are only addressing the immediate outcome of by providing the maternal, the during the pregnancy. So therefore, women enter pregnancy, the child, like, with adequate nutrition, rather than we are repairing the case at the time of pregnancy is what, there is limited, there physiologically the demands goes high. Any of the medical reasons which makes her to be consuming much less nutrition than the other thing. So therefore, it is important to be addressing the preconception nutrition, specifically focusing on what Dr. Hemalatha said. Adolescent is also a larger group. Newly married women and those who are planning for even including the second pregnancy or subsequent pregnancies. Because we also know that the family planning or the gap between pregnancy has a critical contribution in terms of the nutritional outcome, the child's health, the women's, these things are there. If you do not address these things, the desired outcomes which we probably expect, we are not going to get it. So therefore, it is important that we need to be looking. 1,000 days is important. I do not deny personally that 1,000 days is important, but we need to expand and see that it's beyond and more than 1,000 days if you wanted to really make a difference in the nutrition status. Yeah.
Right. So I want to come back to Subbu. I'll come back to you in a second here, but I want to go to Pooja on this issue. So right now, so far we are saying its first 1,000 days are important, but also advance that focus a little bit to pre-pregnancy, pre-conception. What do you think? And it's sort of slight departure from what you were trying to articulate earlier.
Yeah. So actually, I think, the 1,000 days essentially gives you a much more sort of focused window of opportunity. And that's largely what there's, because there are specific interventions and very specific things that are done or should be done essentially through that time period. But I do like the idea of some bit of preparation pre the 1,000 days, right? So in line with, one is the whole preconception, work that can be done. But I'm also wondering if, when we look at young married couples, that there are conversations that the health system is already reaching out to them with regards to, say, family planning interventions, that might also actually be a good time to also intervene on nutrition interventions, because you already have a system that's speaking to that audience, and preparing that audience at that time period might actually give you, like Minnie said, like Dr. Hemalatha said, a bit of a longer runway to ensure that some of those practices are adopted well in time before you actually hit the preconception in even the actual pregnancy time period. I don't know if there's been any specific study that's done that intervention to look at exactly if there are measurable outcomes that we might be in a position to evaluate and say, hey, this is actually working. But I think that intervention, that preparing prior might probably give us that, like I said, that longer opportunity and that longer window of opportunity, including preparing even the family members. Like we say that you've got the ecosystem of influencers that impact the decisions of the young couple, preparing them along with the young couple before you enter the 1,000-day window might actually be a nice way of ensuring you've already started to get towards those markers. But a 1,000-day, like I said, has very, very specific interventions, and those absolutely need to continue to be outlined and underlined and underscored enough and more times, because we are missing important parameters, even though those interventions are happening. But definitely there's room for us to do better there as well.
Great, thank you. So Subbu, I want to come to you on this. You brought in the Swedish study, the Swedish adoption study, but I have also heard you argue eloquently about other age groups that are not getting attention. And so what do you think about this thing?
So I mean, obviously, this need not be a this or that, and I completely understand the need for focus. Any policy is a process of optimization. It's not It's not going to be just where the evidence is. Maybe the levels of stunting, if you look at above 2, is way higher, and not all of those are just coming from under 2. When we look at Young Life study, about 35% of the kids become quote unquote unstunted after age 2, and some become stunted. So the picture is like kind of quite in and out, especially when it comes to anthropometry. But I do agree that if you have to start somewhere, I feel, I may kind of probably agree, like with Hemlatha, that we need not abandon this, but the question is, what do you do in those 1,000 days? I don't think whatever we are trying to do right now is going to have much impact. And that's where it's missing. I concur that, there's a breastfeeding thing, but if you look at DHS country, amongst all the inputs into what might be nutrition, breastfeeding is about the best. Even at 50% or 40%, it's way better than adequate diet, for example. I feel the one issue is the start of the food at 6 months. It's really abysmal. So if I take a food-based measure of nutrition, the level of undernutrition in India will multiply by 2 times. Adequate food, Hemlatha mentioned, it's like 80% of the kids do not get adequate food as an average number, right? So and then when we do the diversity, whichever way you slice it or dice it, there's a protein deficiency. But the fact is, 1,000 days can be important in my mind, at least based on what the data shows, from the data part, not just editorials. One is that kids are not going on food at 6 months. Why is a question. Is it just knowledge? Is it food insecurity? Or it's a mix of various things? So that's number one, because those are really, really bad. And, if you take 6 to 12 months, the rates are extremely, extremely high in terms of just sheer food deprivation, what's being fed to them. So I don't think it's all knowledge, because after year 1, I don't think any mother is under the illusion that she lacks the knowledge, even if it is just cereal. I mean, the fact that kids are not eating anything. So I just want to push that in the 1,000 days, if we are focusing for nutrition, you have to start where life starts, which is at 6 months, they start moving away from the breast and start eating food. And they have to. Right? That's the only way you're going to grow, regardless of what happens before. So that's number one. I think preconception is very important, but again, the question is, what do you do? Right? And that's where I think that the social determinants of health needs to come as an overarching theme, because if you can delay the girl's marriage, you are delaying everything later. She's in a better health. She has attained her full height. So child marriage, like we were just looking at it, it's a legal thing, right? So, and there's not one single parliamentary constituency or district in India, including Kerala, where child marriage is 0%. It's a legal thing, right? And it can go as high as 45-50%. That's social determinants of health. The strongest determinant of any nutritional indicator, you slice it, dice it, we looked at 25 different inputs. It's the wealth, household wealth. So what is it capturing? I think it's capturing not just money, but a sense of security. Whether it's economic security, women's empowerment, a combination of things, because these will travel together. So Vish, my point is, if you want to get specific, I feel that whatever has been called as complementary food, and I feel it should not be called complementary, because at 6 months, that is the main food. The breast should be the complementary at that point, of course, because you can't keep saying it's complementary food. It is food. You need to eat. So, and then something else becomes supplementary, that you don't have to quit the breastfeeding for all kinds of other benefits you can get. So we need to change that focus. When the kid is ready to eat, are they eating? That's one focus. And then we can talk about both quality and quantity. I don't think we have solved the quantity issue. Obviously, the knowledge issue is a huge issue actually among the better off. It's like people like us. Obesity rates among people like us are very, very high. So I think there is both a quality issue and a quantity issue. And I don't think we should we should not do one thing after the other. If we can do both together, it's obviously more efficient. These need not be delinked. And the preconception is important, I feel, from the social determinant standpoint. And the big puzzle that probably I find is this low birth weight issue in India. This is a kind of more, I think we need to dig in more. I'm sure Hemalatha and her team at NIN are thinking about this a lot, because this is then you're talking about a very generic problem. Even in a country like United States, we have like 16% low birth weight, and because obesity can also lead to that. So it's kind of a, so there is, because then it sets you up on a different trajectory. So Vish, there is a kind of a level of science that we need in India and what might be different. But if we have to focus on the first 300 of the 1,000 days, which I completely concur with Hemalatha, we need to focus on the social determinants. Thank you.
Great. Thank you, Subbu. That's very helpful. People are thinking maybe I'm doing something else on my phone. I'm getting messages from the audience, thanks to Ramya. So it's not that I'm doing something else and not paying attention. This is what distracted living is all about, I guess. So, but no. So yeah, multitasking only for with a very specific goal here, right? So thank you. Thanks, Subbu. That was very good. There are a number of issues that are coming up. We won't obviously have time to address all of them. But I just want to warn or alert everybody. So be ready with your questions. I'm going to open up shortly to ask questions. But there's one issue that keeps coming up, and I thought I'll go to Pooja. Pooja, if you can wear your communications hat. There is some, I won't say confusion. It's not confusion, but certainly the messaging seems to become more broader here. To focus on preconception to first 1,000 days. But we are also talking about quality versus quantity. It's very difficult to communicate that, as a, that's not how people think. And then, of course, what should be the outcomes? What are you focusing on, right? Is it, different micronutrients, or is it sweets? Is it fat, calories, whatever, right? There's so much confusion out there. And of course, we are not the only people, unfortunately, in this field. We have a huge advertising industry whose business it is to make us eat bad quality in large quantities. So if you want to put your communications hat to it, how do we solve the problem in the next 30 seconds or 40 seconds?
I think
it's an easy question for Pooja.
We break down the problem and we simplify it, and we give people one message at a time. I think what happens is that, like you rightly said, we are bombarded by a lot of different messages coming from a lot of different actors, a lot of different industry actors, private sector, public sector, and all of them are very convincing. All of them are very well crafted. All of them are really sort of nudging us and tempting us, if I may use that word. I think the one thing that we need to improve specifically in terms of public health communication really is understand people, understand their barriers, understand what are the norms, traditions, cultural sort of mindsets they're coming with, and then speak to them in their language. One of the big pieces of learning for me has really been that, communication, specifically when we talk about contextual communication, we really need to make a lot of things easy, simple, and hyper local to some extent. How do we sort of not necessarily use a cookie cutter approach and say, hey, you know what, I'll give this one message and everybody will understand it the same way. Right from this young adolescent girl to this young mother to the mother-in-law, and everybody will sing the same tune. It will not necessarily happen like that. In fact, very rarely does it happen like that, because what we are trying to do is shift people sometimes from what seems to be the most lucrative and tempting behavior to follow to something which might be slightly different from what they've been, what they've been growing up with. Or we've seen examples of like Professor Sabu spoke about the 6-month barrier and the challenge at 6 months. And there have been instances where research tells us that people are waiting for the 1-year mark because there is a particular cultural or ritual that needs to happen at the 1-year mark, and that's when the child will be fed. Right? So the complementary feeding actually sometimes gets delayed by as much as 6 months, because of a cultural, traditional norm that is established in people's minds. How do we break those traditionally solid ways of operating that families have, communities have, and then come in with one simple message, something like a got milk, right? I mean, a simple one message that really helps communicate the need as well as the action that people need to take. We say a lot in every message. Like I've been saying a lot. You asked me to speak for 40 seconds. How do I cut that down? How do I cut my 3 minutes down to 40 seconds? Give you one message. And to me, that is really understand the audience and simplify the message.
Thank you, Pooja. You owe me 120 seconds at some point.
Sure.
I'll demand that. We are running out of time, but so I'm going to select one question, which is to all panelists, so that way everybody can address this. And there are individual questions to each panelist. We can share them with you, or feel free to answer that. As the panelists have mentioned, counseling for nutrition is important. But currently, is there a focus on, and this is a broader question beyond counseling actually, is there a focus on investing in human resources, like training more ASHA workers, nurses, frontline staff? How can we make this a priority? I think I was going to ask actually a provocative question about it. Is it too gendered, our conversation? We're always focusing on the mother, putting the onus as if, she's the only person responsible for this. That kind of a gender discussion also bothers me, and not just this panel. I mean, in general, I'm saying. So, but there is, as some of you have pointed out, it's beyond, it's a household, it's an ecosystem. So are we investing in sufficient human resources? If so, where should we invest? Maybe we can quickly go 30 seconds each from each panelist on this, so that we can end this on time. Can we start with you, Varghese?
Yes, very relevant and very pertinent question. Before that, I probably will pose another question to say that, do we know the puzzle well? How do we counsel women to adopt complementary feeding practices? In fact, this is some work within my organization. Currently, we are doing to unpack, to see that what it takes to do interpersonal counseling, specifically 4,000-day programming. So it is not just the health and women and child human resource that has been there, even the human resource which is there right now, their capacity and their skills to do it in the right way. That itself is, we do not know, being very honest. This is my opinion, very personal opinion. Yeah.
And that's fine. Personal opinions are allowed, right? That's the way we had you here. Wonderful. I know it's a very short, terse response. That's what we are asking for. That's one part of it. So, Pooja, what would you say?
I think a lot of work has been happening in terms of training the healthcare workers, training the Anganwadis, getting a lot of the on-ground, healthcare ecosystem and the nutrition ecosystem to really be skilled and sort of upskilling them on a continuous basis. And I know, for example, a lot of technology is being brought into how they can efficiently sort of have access to information as well as communicate that. Is it a job done? Absolutely not. There is a lot more to be done, and it's a continuous process. But is a lot of that happening? Absolutely, yes, including community workers, PRIs. I mean, the whole ecosystem is being brought into the conversation, and not just the ASHA worker or the Anganwadi worker. So I think there's considerable progress, but more to be done.
Great, thank you. Dr. Hemalatha? You have to unmute yourself again. So, right, can we unmute?
Capacity building is there in place for Anganwadi workers. All those things are there, but then um, counseling will work only when accessibility and affordability of food is there. You go to any remote place in India, go to the remotest village, you'll find a Coke, you'll find chips and biscuits, but fruits and vegetables will be hardly available. Even if they are available, it will be very expensive. So accessibility, affordability, along with counseling will work. And yeah, that is a quick thing. And the next one is gender. About gender, if you're saying yes, investment with girls will be much more efficient in bringing the returns than investment in boys. And I would also like to add that even today, even with so much investment, you see women more malnourished than men. 25% of men have anemia, while 53% of women have anemia. And undernourishment, overweight, obesity also, the numbers are higher among women compared to men. Of course, the child malnutrition improvements are there, 2% point better among girls compared to boys with respect to stunting, wasting, and anemia. So it makes sense to invest on girl child and women because it translates to society, to the family and society. Thank you.
Right, thank you. I think maybe I did make myself clear. I did not say that we should not invest in women. I said, are we putting too much onus and responsibility and burden on the women rather than the system?
Sorry.
That's no, it's okay. It's okay, because I wanted to make that clear, because we keep saying that as if she's the only person who should take the responsibility, right? I mean, the whole general discourse, not here. Subbu, where would you invest? You didn't like technocrats earlier. I'm putting words in your mouth, but so where would you invest in terms of human resources?
I mean, if I have to go by, what we have learned or where the data shows the biggest return, I would say that, maybe look for like non-health or like, as I would just keep saying the same thing. I think livelihood generation would be a big one. And within that, I think like female labor force participation. Unless and until these fundamentals are in place, which can then contribute to improvements in women's empowerment and improvements in household standard of living, better ability to negotiate, then all these things will stick, counseling, etc., etc. You can't counsel somebody for 50 years. We just don't have the resources. So you can go a couple of times. So I would say I would look at all these other programs that are happening and then see, and we did some papers on convergence, and it was very clear that the ministries outside of WCD, because we linked indicators to different ministries, like 8 or 9 of them. And it really kind of, the impacts of other things, whether it's like asset creation or energy, etc., like, Beti Bachao, all of these have about the big impacts, because once you look at these non-health or non-directly nutrition based, that's where I would invest. And the other place I would invest is, just to underscore Hemalatha's point here, is on this food affordability or quality food. This is going to be a very big issue for India. It is simply not affordable. We can talk about quality, or you shouldn't eat this, or you shouldn't. That's a discussion for us. But things are very expensive, and they're only going to get more expensive. So especially if you're going to talk about quality food. So anyway, so those are the 2 places where I would invest, like on the, how do we leverage the current system for food retail? Is it still the PDS story, or do we need something else? Maybe there are some lessons from the success of COVID, where India did manage to deliver relatively higher levels of food grain to people, including pulses, to kind of attenuate the effects of COVID. And I would say livelihood generation. Look at the spillover effects of other programs.
Fantastic. Thank you, Subbu. We are really out of time. Actually, we are beyond the time allocated for this. My apologies. If there are other questions, you can accost Pooja and Ms. Varghese here and ask them questions. And of course, Subbu, if they want to contact you, I hope they can. We know where to find you. So,
Sure,
and
anytime.
Hemalatha, hopefully they can reach out to you if they have questions. But let me call it a day here. Let me start by thanking the panelists, Dr. Hemalatha, Dr. Subramanian, Ms. Varghese, and Dr. Sehgal. Thank you so much for taking time away on a Friday evening, to come and spend time with us. There are a lot of questions, a lot of interest. This is one of the most significant areas. So I'm glad we have begun this conversation. I also want to thank the audience. Again, this is a Friday evening. Instead of going to some restaurant and eating high quality, high quantity food, you are here. Hopefully we will have the so-called high tea. I don't know how healthy it is. If not, we'll blame Neha. But I also want to thank my staff, the team at LMSAI, Lakshmi Mittal South Asia Institute, and the Harvard Chan India Research Center have worked very, very hard. They've put the entire thing so quickly together. So thank you so much for doing this. Thank you, everyone. We have a lot of other issues to discuss. I can make one promise that Subbu asked me for. I'll get into trouble if I don't fulfill his promise, because he knows where I live as well as where I work. So that this is only a starting point for a conversation. We are going to, this is a major area of focus for the center. We'll continue to have these conversations in the future and other programs around this. So thank you, everyone. Thanks for joining us. Let us give a big hand to the panelists.
Thank all the panelists. Thank you, Dr. Viswanath. Thank you, Dr. Subramanian. Thank you.
Thank you. Thank you, everyone. Yeah, what a pleasure.
Had
Yeah,
very interesting discussion.
likewise. Thank you.